Are you or someone you know considering spine fusion surgery but feel nervous about what to expect? Spine surgery is intimidating, but understanding what to expect before, during, and after your procedure can make all the difference. In this video, I'll break it down for all of you so you feel much more comfortable every step of the way. Hi, I'm Dr. Deeptee Jain, an orthopedic spine surgeon, and I've helped thousands of patients through spine fusion surgery. If you're considering spine surgery, this video is for you. I'll walk you through what you need to know from the consultation to your full recovery so you can feel confident every step of the way. And if you're new here, don't forget to subscribe and hit the bell so you don't miss out on future videos about your spine health. I know that spine surgery can be overwhelming, and many of you have questions about what to expect. Will the surgery be painful? How long will surgery take? These are all valid concerns, but I want you to know that with the right preparation and care, spine surgery can be a life-changing procedure that brings relief. Before we get started, I want to remind everyone that there are lots of different ways to do spine surgery and perform a spine fusion, even for the same problem, believe it or not. Spine fusion is a spectrum. I do everything from fusing a single segment in the cervical or lumbar spine to fusing almost the entire thoracic spine and lumbar spine, from the top of the back to the low back. So with that being said, let's break it down into 3 simple stages: before, during, and after surgery. The first stage is before your surgery. This is where we plan and prepare for your procedure, and here's what happens during this stage. First, consultation and diagnosis. Your doctor will review your medical history, perform a physical exam, and likely order imaging tests. These tests usually include X-rays, an MRI, and sometimes also a CT scan to get a clear picture of your spine. The next part is discussing surgery. So once your doctor confirms your diagnosis, he or she will discuss the specific surgery you're having and why it might or might not be the best option for you. As I said before, there are lots of different ways to fuse the spine, and the exact details will depend on the type of surgery that you're having. Next, pre-surgery instructions. Most doctors typically give instructions on how to prepare for surgery. This may include stopping certain medications, fasting before surgery, and arranging for post-surgical care. I personally have a checklist that I give patients, which I can definitely share in the comments below. Just ask. Make sure to follow all of the pre-surgery instructions carefully. This helps avoid complications and ensures the best possible outcome. For example, if a patient is on a blood thinner, I often recommend that patients stop their blood thinner in order to have spine surgery. If a patient is on their blood thinner and they're undergoing spine fusion, this risks a potential complication down the road. So now let's talk about what happens during your surgery. It is so normal to feel anxious. Spine surgery is scary and bad things can happen. But remember that you'll be in good hands with an experienced surgical team. And here's what you can expect. So first, anesthesia. Usually, you'll be given general anesthesia to ensure that you are completely asleep and comfortable during the surgery. There are some surgeons, although there are not very many of them, who do perform spine fusions in awake patients, but it's not super common. The surgery itself will vary depending on the exact procedure you're having. If you're interested in learning more about different ways to perform a spine fusion, you can check out my website at deepteejainmd.com, where I provide links to well-trusted and established resources about specific types of operations, including the North American Spine Society and the American Academy of Orthopedic Surgery. During surgery, there's a lot that goes on in terms of monitoring and safety. The anesthesia team will monitor your vital signs throughout the procedure to make sure that everything is going smoothly. Oftentimes, we also monitor the nerves during surgery with what is called neuromonitoring, and this allows us to detect if there are any problems that go on with the nerves during surgery. So the final step, after surgery, and this is where the real work begins for the patient, recovery. This stage is crucial for healing and getting back to your normal activities. So here's what to expect. Post-op recovery unit. So you're going to spend some time in the recovery unit where nurses will monitor you as the anesthesia wears off. You may feel some pain, but don't worry. They often have pain management options to keep you comfortable. Next is a possible hospital stay. Depending on the type of spine fusion you have, you may stay in the hospital for a few days or you may go home. I personally perform a lot of minimally invasive spine fusions, which helps me discharge my patients the same day and help them get back home as quickly as possible. If you are admitted to the hospital, the surgical team, and oftentimes a medical team as well, will monitor your progress. Once you're home, sometimes your doctor will recommend physical therapy to work on mobility and strengthening. Not every surgeon recommends and offers physical therapy to their patients after spine surgery. I tell patients that the most important thing to do after a spine fusion is to walk as much as possible, including the day of the spine surgery. So next is hopefully returning to normal. While you'll need to rest and avoid heavy lifting, many patients begin to feel significant improvement within a few weeks. It can take months to a year to fully recover, but what I tell patients is I expect them to be better than where they started when I see them back at the 6-week mark. Don't rush your recovery. Patience and following your doctor's instructions will make all the difference. So to recap, here is what you can expect before, during, and after spine surgery. Before, consultation with your doctor, getting a diagnosis, and obtaining instructions on how to prepare. Second, during surgery, anesthesia, surgery, and monitoring. And third, after surgery, recovery, walking, sometimes physical therapy, and a gradual return to normal activities. So if you're considering a spine fusion, knowing what to expect will make the process much easier. If you have any questions or concerns, leave them in the comments below and I'd be happy to answer. Don't forget to like this video, subscribe for more valuable tips, and share it with anyone who might benefit from it.